Hi, I'm Dr. Natalie Marks, and we're back with another quick cup of knowledge. We're joined today by Stephen Cital, a registered veterinary technician. He's also COO of Veterinary Anesthesia Nerds, Director of Education and Development for Elevet Sciences, and co-founder of the Veterinary Cannabis Academy. Thanks so much for being here.
Thanks for having me.
We're really excited today because there's a lot of new information coming out surrounding cannabis and its research and use in the industry. I want to first hear a little bit more about some of these groups you're involved in, especially the Veterinary Cannabis Academy.
Sure. So the Veterinary Cannabis Academy was founded by myself and a good friend and colleague of mine, Liz Houston. And we were trying to fill a void for the lack of information when it came to these particular molecules that come from the cannabis plant, whether it's hemp or marijuana based. And we wanted to have an open platform where people could share what they're experiencing, share some of the data that's coming out, and just have an open, honest conversation about this, because so many of the classic associations are still kind of in that mindset of it's taboo and we don't necessarily want to talk about it, or let's not talk about it. So we wanted to fill that void, and that's exactly what we did.
And I think for a lot of practitioners and technicians and students, all of a sudden we're hearing about it. But what is the history behind its origination and use in the industry?
Absolutely. So we know that humans and animals alike have been using these plants, or plants that create these things called phytocannabinoids, which are the molecules that work on a certain set of receptors, for millennia. Whether they were doing it intentionally or just getting it in their diet naturally, we know it's been used for thousands and thousands of years. As far as its introduction to veterinary medicine, if we go back before the 1930s, we'll find tinctures with things like THC or even CBD or some of the other molecules that weren't defined back then in medicines for veterinary patients. Specifically, colic for horses was a big one. And it was kind of funny because some of the labels say you can give it to your horse and you can also give it to your mad wife who was actually just stressed out or maybe had a headache or something like that. So there is really interesting medicines from way back in the day. And then we had essentially the prohibition against cannabis or any of the things related to these types of plants from the cannabis sativa L plant in the 1930s. And then since then, and recently, till Colorado really started its own state legalization, we kind of forgot about it. But it's a very active system that we have a lot of data for in the early 60s, 70s, 80s, and now the research is just booming with the interest. So it's been around forever. We just forgot about it, got scared of it, or whatever the stigma may still be surrounding it, just kind of hindered things for us.
Yeah. And to clarify for the people watching this, can you explain very specifically the differences between THC and CBD?
Yeah. So THC and CBD are two of the most common molecules that we talk about that come from the cannabis sativa L plant. And I think for all intents and purposes, we really have to talk about the two different plants that fall under this kind of umbrella of this genus of plant. One is the hemp plant, and then one is the marijuana plant. And so the big differences between the makeups of these molecules in these different plants is the hemp plant is dominant in CBD compared to the marijuana plant, where it's dominant in THC, which is also a legal precedent that is set out there. Hemp is a cannabis sativa L plant with less than 0.3% THC in it, and then marijuana is the opposite.
Okay. And again, I think it's important to clarify for people listening
absolutely.
Because there's a pretty significant difference
Huge
there
difference.
in use, right? So speaking of that, you've been involved in a lot of the forward movement of applications of these in the industry, right? And what are some studies going on right now, or some different clinical uses that people are starting to hear about and work with for our patients?
Sure. So when we start to talk about treating things with these types of products, we really have to be careful, because when we say we are treating something or we're trying to prevent or mitigate a disease, that turns that product into an unapproved drug. And so we have to be careful, and we need to look at these molecules so far until the FDA gives us better guidance as a supplement to conventional therapy. So we can aid in decreasing maybe discomfort in animals. Specifically with Elvet Sciences, they helped fund a study at a Cornell University where they did a clinical efficacy study looking at the utility of these molecules, predominantly CBD, CBDA, in decreasing pain scores for animals with osteoarthritis. So that's a huge one. Colorado State just released their pilot study for epileptic dogs and are continuing on with a 3-year-long study, as is Elvet, with a different product, which is really exciting. And then we have a lot of interest, of course, in the oncology realm. And certainly things like anxiety. So anything that we see a lot of media around as far as utility of these particular things and potential positive outcomes in humans, we're seeing that in animals as well.
And it brings a lot of excitement, of course, because it's something new and something that certainly seems to have a widespread application use. But you bring up sort of this legal nuance that I think we all need to be aware of. And what are some of the things that practitioners, not only in regards to terminology and how we're actually discussing this, what are some things that we need to still be aware of because this is so new to the industry?
Sure. So I'm certainly not an attorney, and I would say to anyone if they have questions to contact their personal attorney or an attorney that is familiar with cannabinoids or cannabis law. And I think that's really important because there's been a lot of misguidance and confusion as far as looking at state legislation versus federal legislation, what this means versus hemp versus marijuana, for instance. So we have to be careful and we have to use the right terms and understand that at this point, marijuana is still federally illegal. So practitioners need to not carry this in practice. That is a big no-no. Can certainly get your DEA license taken away from you and can certainly get in some trouble from your veterinary medical board. So marijuana stuff on the legal side is hands-off for us. When it comes to hemp products, it's much different. We only have a handful of states, I would say 5 states right now, that I would feel really uncomfortable, or I would tell the practitioner to practice extreme caution when utilizing or selling hemp-based products. But the rest of the country, I'm pretty comfortable. And we also need to note in the record that you are using these products for a while. I had even advocated, which I now regret, that we maybe not put it in the record because of the liability. But I think the real liability is not having these harm reduction conversations with pet owners who are going to go buy it from Joe Schmo off the street or the gas station, right? And then not mentioning in the record, so if they go somewhere else and there is a drug-to-drug interaction or some complication, we don't have a full medical picture for this animal. So I think it is important to write it in the records, but we do need to stay away from certain words like prescribed or dispensed because, again, that makes that supplement product into a unapproved drug. So we should say things like discussed harm reduction therapy with CBD products, or owner wanted to use X product, and carry on the conversation like that instead of writing RX'd or dispensed a product specifically for a specific disease.
And I'm glad you brought up clients saying, well, I just went to the health food store around the corner and picked up a hemp-based product that they said was okay for pets. And what is your comment to practitioners who are hearing that? What's the bullet point, that talking point that really secures that we are the knowledge base for this?
Sure. I would say be careful because this is an unregulated industry at this point, and we don't have really strong regulations as far as what's actually in these products. The FDA has pulled several products. Penn has done a study where they pulled several products, and what's on the label does not match what's in the bottle. Whether it's inert chemicals are in there or actually dangerous ones, we don't know because no one's testing this. So we have to exercise extreme caution. And I think the first thing that practitioners can do is ask for a certificate of analysis. And on there, it should tell you everything that's in that product. And if a company is unwilling to give you a certificate of analysis, it's probably not a company that I would want to recommend. I think the other thing that we need to be very cognizant of is maybe supporting companies or buying from companies that will not only give you the certificate of analysis, but actually have PK data or clinical safety trials going on or already completed, which is easy for me to say because I work for Vet Sciences and we have that. But I think that is important because all of these products are not the same. We can't necessarily expect the same results from one study and apply those results to a different product.
Right. We're almost out of time. I know we could talk about this for
Yeah.
hours, but just briefly, where do you see uses of cannabis, or at least the discussion or research of use of cannabis products in veterinary medicine going?
Sure. So I think the big one right now is definitely supporting animals that may be uncomfortable for age-related, osteoarthritis-related conditions. Certainly, some cognitive support is going to be a big topic, and we have a lot of development in the kind of cancer realm and just realm, and increasing quality of life for some of these aged animals or particularly painful animals.
Which is the goal of all of us, right?
Absolutely.
Is to better our patients. So lots more to come from in the world of from the Veterinary Cannabis Academy, as well as from the research studies, and we look forward to what's ahead. Thank you so much for your expertise and time.
Thanks so much.